about water balance, which is a really important part of the kidney function. And so we're going to start with objective 1 here, which is to explain the concept of balance. All right. Okay. Now, balance really implies homeostasis, okay, but really as it pertains to water input and water output. And so this is a function of homeostasis because we need to keep these two volumes the same. The amount of water that we're inputting and producing should be equal to the amount of water that we're using and putting out, okay? And so as a part of maintaining homeostasis, so keeping our water volume, our plasma osmolarity constant in the face of inputs and outputs is what we mean by maintaining that balance, okay? So the kidneys help to regulate solute and water content, which also helps to determine our volume. And we're going to make this connection as we go along, but solutes move with water, water move with solutes. This is why as a part of curing hypertension, we also give patients diuretics so they can lose that salt and they lose water along with it. So solutes are always going to follow water. If we have a lot of solutes in the blood, we have a lot of water in the blood, and that's how we get high blood pressure. And so that's what we mean by determining our blood volume, which therefore influences our blood pressure, okay? The kidneys also help regulating acid-base balance. We're going to talk about how hydrogen ions being secreted across the tubules, bicarbonate being reabsorbed across the tubule play a really crucial part in balancing the acid and the base in our plasma. They're also going to be working in tandem with the lungs. So we didn't speak about acid base as it pertains to the lungs, but we're going to combine all of that at the very end of this and talk about the general acid base as it is being influenced by the lungs as well as the kidneys here. And then the composition that's also affected by the exchange between different compartments is another thing that is being influenced by our plasma, our exchange of water in this area, in the kidneys. So essentially the movement of water from cells to connective tissue, from the GI, things like sweating, respiration. These are all ways that we can manipulate, or compartments that we can manipulate water movement to and from. Okay. Let's look at objective number 2, which is to describe the different sources of water input and output. So kind of adding a little bit more clarity to what we just described. So this is a really nice schematic that shows us what we just mentioned. There are different mechanisms for moving water across our different compartments, and there are different processes that are involved as well. So urinating, sweating, hemorrhaging, excretion are some of the involved processes of regulating water from our different compartments. So let's kind of start at the left here. So we ingest water, right? And we should be ingesting water in, its normal state as fluid, but a lot of the foods that we eat, especially fruits and vegetables, also contain a large proportion of water as well. That moves through the lumen of the digestive tract, and then that can be absorbed across into our internal body compartment. So that's in our plasma, in our interstitial fluid, which are the extracellular fluid compartments in our internal body environment. We also have another process taking place. So there's secretion also happening across the lumen of the digestive tract. And while it's not a whole lot of secretion, there is a small amount of water that has to move back into the lumen of the GI in order to aid in that mobility, in order to lubricate the GI and to allow for those substances to move through from the proximal parts to the distal parts for excretion. At the very end of the GI movement, we see excretion, which again is a very minimal water loss, or a small amount of water is lost in the feces. And so this is how we move water in and around the GI tract as a part of digestion. If we look at the internal body compartments moving from our plasma, we have exchange taking place between our plasma and our cells, so water moving in and out of our cells. We also have exchange between other extracellular connective tissue. Things like bones have water, things like tendons and ligaments have a small amount of water in them as well. And then the main source of exchange between our plasma is going to be filtration, where we see that filtering of our plasma across the glomerulus into the renal tubules. And then we also see secretion of some of those substances into the renal tubule as well. And then a large part of that is reabsorbed in order to maintain our plasma concentration. So this is why it's so important to reabsorb most of that water that is filtered to keep the amount of fluid in our plasma at a constant level, to keep that, that hydration, that volume. Other ways that we lose water through our plasma is other types of loss. This is called insensible loss. So things like speaking, right? We lose moisture through the respiratory tract. We've got sweating, hemorrhaging, even saliva is a way that we lose water as well. And that is a very small amount of water that we lose through these mechanisms. And then another main source of water loss from the body in general is going to be excretion. So excretion via the process of urination or micturition, which is where we see the filtrate that has been fine-tuned after we've reabsorbed most of that water is lost via the urine from the body in general. And this is just a large schematic that's showing us how water is moving in different areas, but we'll talk about this again later on and really highlighting how these inputs and outputs really need to be balanced. So the mechanisms by which we lose water, so feces, urine, sweating, should be balanced by the mechanisms by which we ingest water or intake water. Okay, all right. So when we speak about balance, we're talking about solute and water entering the plasma and exiting the plasma at the same rate, right? So that the quantity within our plasma concentration, so jumping back here, this volume stays the same, right? That homeostasis component where our plasma concentration stays the same. In that regard, we can think about positive water balance. So this is where our solute and water are entering the plasma at a faster rate than they are exiting. That's going to lead us into a state called hypervolemia. That can also lead to hypertension. Remember, I said that solute and water travel together. If you're retaining more solute in the plasma, we're also retaining more water in the plasma. That leads to higher blood pressures. That leads to higher volumes, right, which exert a higher hydrostatic force in our plasma. And that's not ideal. That's not what we want. And then we can also think about the alternative scenario if we have a negative water balance where we have solute and water exiting the plasma at a rate that is faster than they are entering. So again, the quantity is going to decrease here. We could think about dehydration as an example here, hemorrhaging or bleeding out as an example here. And as you would imagine, we lose volume, we therefore lose pressure because we lose solute and water collectively, okay? All right, and then looking at some of the cells in the late distal tubule along with the collecting duct, this is where we see the regulated reabsorption of water, the regulated balancing of that water. This is how we can really function to have some control over how reabsorption is taking place. So we talked about the proximal part of the tubule where reabsorption is happening freely. Okay, irrespective of our hydration status, that water is just being reabsorbed ad libitum, right? At the distal part of the tubule, we have some say in that. We have some control in that. There are principal cells, there are intercalated cells that are releasing hormones and allowing hormones to bind here as well, that are helping to regulate this process in terms of the needs of our body. So if we're well hydrated, we're going to see less of those hormones. If we're not well hydrated, if we're dehydrated, we're going to see more of those hormones. And so the distal parts of the tubule and the collecting duct is where we can sort of have an input via the nervous system, via hormones, and via the cells that we're going to speak about, the principal cells and the intercalated cells. We can have some regulation, some input as to how water is being reabsorbed, depending on the needs of our plasma and the needs of our body. Okay. All right. I'll take another pause here and see what questions we've got so far. Okay. So objective 3 is to explain the control of water balance and osmolarity by antidiuretic hormone. So antidiuretic hormone, also called ADH or vasopressin, is another one of those hormones or is one of those hormones rather that we are mentioning or referring to when we talk about regulation in these parts of the tubule. And we'll talk about how they bring about balance a little bit later on. So the osmolarity and the movement of water is one thing we'll speak about here. So that's probably the only thing we'll get into. We'll talk about the other topics later on, probably Wednesday and going forward. All right, so here is another look of kind of reiterating that relationship between inputs and outputs and positive balance versus negative balance, and how we should have a matching between water that we're inputting and water that we're using up or excreting. And so we have sources of input like the GI tract, like metabolism. So as a part of cellular respiration, if you remember way back when from cellular respiration, when we when we have that final electron being accepted onto oxygen, we produce a small bit of water as a part of that process. So cellular respiration actually produces a small amount of water as a byproduct of that oxygen accepting that final electron there. And so that produces some bit of water as well as what we ingest. So those are sources of intake. And then we have outputs, which are insensible loss, things like saliva, things like respiration, speaking, sweating, the GI tract where we see feces having a small bit of water being excreted, and then the kidneys where we see most of that water being excreted via the urine. All right, and so I'm not going to go over the details of this flow chart again, but I will just think about the values here in terms of the volumes. And so we input about 2.5 liters per day, drinking or ingesting via food 2.2 liters, and then creating via cellular respiration 0.3 liters. So that's 2.5. And so we should be outputting that same amount of water per day. So excreting via feces about 0.1 liters, other loss, so insensible loss, sweating, etc., 0.9 liters, and then urinary excretion about 1.5 liters. And so that sums up to 2.5 liters a day. So the main thing we want to point out here is that our intake should be matched exactly by our outputs, okay, in order to keep us in that state of balance. And so thinking about, again, about that idea of balance, we can have normal volemia where we have a normal blood volume. If we have inputs matching outputs exactly, we can have hypervolemia where we have high blood volumes due to positive water balance. This is also synonymous with higher blood pressures. And then we have hypovolemia where we have a low blood volume due to a negative due to a negative water balance, and that is synonymous with lower blood pressure. So again, linking this idea of our volume, so the amount of fluid in our vasculature, contributing to our pressure, the hydrostatic force exerted by that fluid, which maintains our mean arterial pressure, okay? And we'll make those connections a little bit later on.